Good afternoon, everyone. Thank you for coming to I think this is our sixth presentation of the DICE Brown Bag series sponsored by the Department of Psychiatry. You'll see the disclosures up on the screen. We just ask that you pay close attention and acknowledge that they exist. um, Today, we're excited to have a group of individuals from the community and also within the University of Rochester bringing us information from a therapist, psychologist, counselor's viewpoint. And on that note, I'm going to hand things over to Dr. Traci Terrance so that she's able to introduce and give you a little bit more information. Please welcome Traci up.
All right. So greetings. Good afternoon, everyone. Thank you so much for being here. I just need to move this out of the way. Okay. Um, Dr. Traci Terrance from the Department of Psychiatry and Family Medicine. Also serve as the Director of Restorative Practice Initiatives in the Office of Equity and Inclusion. So I'm really excited to be with you all today to talk about this topic, psychological safety and inclusion from the perspective of clinicians of color. Always have to start with gratitude. First, want to, of course, thank the department for just continuing the tradition of the Brown Bag series. Want to thank Chanel. I said to Chanel individually, and I will say publicly that she has done a stellar job with the series this summer, which I believe her inaugural summer of coordinating the effort. And of course, thank you to the panelists who I'm going to introduce in more depth in a few minutes. But thank you for your time, being willing to come and share your knowledge and experience with us here. So I'm always a person that likes to start with the context. And as we move into the topic, I think that it's important just to share a little bit. Like when we talk about this idea of inclusion, psychological safety, our mind often goes to the patient experience. And this conversation is going to, of course, include things about patients, but I also wanted us to think about what does that mean from a workforce standpoint? What does that mean to employees of color? What does psychological safety mean for employees of color, and in this case, clinicians of color? So it's important that we have this two-pronged conversation, one that focuses both on the clinician's experience and the patient's. So thinking about the context, nationally, chronic shortage of providers of color in medicine, and that is the same as for mental health. So some statistics here, as of 2023, about 75% of mental health professionals identifying racially as white, with the remaining 25% identifying as a person of color. When we look at social work specifically, social work typically does better than other professions in terms of being more diverse. However, when you look at how many people pass the licensing exam that's given by the state, about 84% of white test takers pass the exam on first try, compared to about 45% of test takers that identify as Black. Similarly, with psychology, just about 3% of psychologists identifying as Black, a bit higher for Hispanic and Asian, and multiple races, but still predominantly white. So thinking about this is Shirley Chisholm, who said, if they don't give you a seat at the table, bring a folding chair. And then that's my daughter next, is probably about 3 or so years old. She maybe was 8 or 9. We were at the Smithsonian Museum in DC where she was looking at the Shirley Chisholm exhibit. But I think about the conversations that typically happen about psychological safety and inclusion are usually about us, but not necessarily talked about by us. People, when you see mental health panels, they're predominantly white. And so for me to be considered in the conversation, for us as people of color to be considered in a conversation, we have had to create our own spaces. We have had to bring that proverbial folding chair. So that was one of the first things that I thought about. Just looking quickly at patient statistics, when we think about, okay, lack of diversity in mental health providers, but also who is receiving services. More than half of people receiving services in our own county, majority white, 21% Black African American, 13% Hispanic Latinx. The amount of people seeking or entering the public mental health system is increasing. However, the percentage of people of color entering that is decreasing. So we really have to think about, again, what is this inclusion? What is it? What does it mean to be psychologically safe? If this is what our data is telling us, both about providers of color and patients of color. So here we go. I want to introduce our panelists, and I have a brief bio to read about each of them. And then, of course, when we get into the questions, they can say a bit more about themselves. But first, Shawn James. Shawn is a wise and compassionate psychotherapist who has dedicated over 20 years of her life to serving others. So for the past 15 years, her heart-centered work has been focused on powerful, transformative field of psychotherapy. She approaches her work with deep relational understanding, walking along adults aged 25 and up, individuals, couples, and families. Shawn also offers mediation and reconciliation services to communities and draws on evidence-based models like CBT, DBT, EMDR, and schema therapy. So I'll also add that there is information on the back table for each of these people today. So please take that and make sure that you connect with them after. Next, we have Sylvia Johnson, a native of Rochester, New York, serving her community, providing mental health services, as well as seminars, workshops, and other personal professional development activities. She is connected to the Community Counseling Circle in Rochester, the Interdenominational Health Ministries, has done sessions for Renewing of the Mind and Breathe Deep, as well as Common Ground. Sylvia serves as the Director of Clinical Services and Support Programs at the Cancer Support Community at Gilda's Club, and she is the CEO of Evolve Me Wellness, which is her own business. Then we have Stergios. Stergios, I need help with your last name. Skatharoudis. Okay, I'm gonna do my best. So keep doing. So currently working as a social worker therapist at Refugees, helping refugees. He holds an MSW and a master's in theological studies from Roberts Wesleyan. He immigrated to the US in 1986 and is passionate in working with diverse, marginalized, and underprivileged populations using trauma-informed practices. Stergios is a lifelong learner, specializing in the mysteries of the soul and the enduring human spirit. Now, I will give a side note here. Stergios and I had a conversation before this panel for Stergios to say, you know, I don't identify as a person of color. I say, yes, I do know this. And your life experience and your work experience is relevant to our conversation today. So I thank you for being here, Stergios. Caswell, a licensed master social worker and founder of Intentional Impact, a telehealth-based mental health service provider. He has a strong commitment to culturally sensitive and comprehensive counseling services and has dedicated his career to serving adolescents and adults facing diverse mental health challenges. Caswell envisions a future where every individual, regardless of background, has access to compassionate, effective mental health support. And then last but not least, Vilma Vendrell, a licensed clinical social worker with over 2 decades of experience, 15 of which have been in Finger Lakes, Rochester area. So she has had roles in care management and emergency psychiatry, currently serving as a clinical manager at Hillside Children's Center, where she leads the clinical team in advocating for individuals with developmental and intellectual disabilities. Vilma is passionate about providing direct behavioral health support and advocacy for marginalized populations, especially those who identify as Black, Latinx, and LGBTQIA+. Vilma holds a MSW, Master's in Social Work, and MPA, Master of Public Administration, with a concentration clinical psychology and administration. So without further ado, I'm going to figure out how to shut this light off so we can have our panelists come to the table with all of the folding chairs here. So I think that is very appropriate. So each of you, will just go in the order that you're sitting. So each of you, we have 3 questions for you just to start, and then hopefully the audience will have some questions as well. But the first question is, what does psychological safety and inclusion mean to you and for you? So you can take 30 seconds to think.
Awesome. So thank you. Again, my name is Caswell Smith. Psychological safety for me and inclusion involves creating a safe space, right, for the individual that you're working with. But not only creating a safe space, it's about being in tune to what the person in need of, right? The idea of inclusion and psychological safety to pair well, just because it's up to the clinician to set the environment where people can establish that therapeutic alliance. So for me, it's a crucial part of therapy when working with a client, because it's the job for me to create or cultivate a therapeutic space where they feel understood, heard. There's no room for, judgment or retaliation. And they feel a sense of connection with the person because they're looking at them as strengths versus, weakness that they might be under the impression that they have, that they're experiencing.
Thank you. Pass it to Vilma.
Hi, I'm Vilma Vendrell. I think for me, psychological safety and inclusion, and being able to be authentic, just straight out the gate, from the minute you walk in through the door, feeling like you have a space where you can speak freely, dress as you feel, and just really express yourself in any which way. I always joke around, you can cuss after 12, because that's, I just want you to be able to express yourself and feel free to be able to be yourself. So to be able to have not just visuals as far as, safe space stickers or, signs, but anything that is representative of your identity. Or mine, so I pretty much do that from the beginning, not just from the questions I ask, but from the visuals, everything.
Hi, my name is Skatharoudis. When I think of psychological safety, I see it as a continuum, and it's on a spectrum, and it's evolving. It doesn't remain static, and part of me as a therapist is to reduce or eliminate power dynamics. What power safety means to me, that mean to the person I'm working with. So I'm always see how they see me, how I see them. So it's an interplay and exchange of visible and non-visible cues, what it means and how it develops over time. So in short, developmental safety is on a continuum and it evolves over a period of time. And I can power dynamics of the thing and how to reduce or eliminate power dynamics for the other person to really feel in sync with me and free to share and be vulnerable and take a risk as I'm taking a risk as well with them. Thanks.
Hello, everyone. I am so excited to be here. My name is Shawn James, and the other thing I want to add to my bio is that I'm a mom, and I'm also a G mommy, and I'm getting used to my new life as a empty nester, right? So I'm sharing that point of contact with you so you can find a port of entry into me, right? So see yourself in me as I can see myself in you. And so later on, as we kind of develop and progress through this topic, I hope to repeat that again, because when you're working with me, I can see that you showed up here today. We have a common interest. So right there is my port of entry to connect with you in a way that is valuable and meaningful. And so that is a part of how I'm going to define psychological safety and inclusion, right? So I want to be connecting with someone where I can find these ports of entry and share a meaningful connection and conversations. And I want you to get to know the uniqueness that I bring and the gifts and talents that I offer to the space. And so that is how I'm going to define psychological safety, because when I have those pieces, I can feel safe within myself. And I think it does start there. I have a strong sense of self and a strong sense of belonging. And I want to bring that to every space that I'm present in. So that is how I'm going to define that. Thank you for having me.
Hello, everyone, and I'm Sylvia Johnson, and I just realized that I took the toughest seat. But you know what? Sometimes it's just not by chance, and I really am a believer that it is not by chance that we have all come into this space. And I want to thank Chanel for, she's been an ear for me complaining. You know what we need? And you know what I noticed? And so I am so thankful that this Brown Bag series had an opportunity to speak to some of the challenges that I know I've faced as a clinician. I have been in working with urban populations for over 20 years. First through Boy Scouts of America, and I would find out how to connect families to the resources that I know that they need. And I wasn't a social worker at the time. Like I was program developer for a particular underserved population. And as I grew over the years, I found they have some different challenges before I can even deliver the program, meeting them where they are. So they helped me develop sort of this psychological safe place, because I knew I had to learn how to code switch on the drop of a dime, which means I can't have to know the lingo and the traditional language, as well as the language of people of color or more culturally responsive language that's there. And then as I moved into social work proper, and I actually ended up in social work proper because a social worker, clinical social worker, thought I was already doing it and said, you should be, that's not what you do. Oh no, that is not what I do. And then I learned more. And as I had the opportunity to go through the various systems, I've worked with Anthony Jordan, Strong. I've worked with Rochester General. as well as other private practices, Rochester Rehabilitation Center, and I saw the disconnect with servicing our clients of color. And I didn't feel safe. So when I knew, that's when it clicked, I need to create something that would address that. And saying, this is the problem that I'm having. I have to know my job to meet the clientele that I service, as well as I need to know the job from the aspect of the European culture. And sometimes the systems just don't match, which forced me to say, I can't get it all done in the time that's allotted, because I have to bring so much of getting that backstory and making them comfortable to work with a clinician of color. And I also at times, but to be honest, I was having to fight my colleagues of wondering, they assume automatically, if you see a person of color, this is a social worker proper that does case management or case resources or doing that. Not seeing that, well, that I'm on the other side, I'm clinical, so that means I don't do that. I know how to do that because that's a base training, but I really focus on the mental health side. And that was difficult, having to work with doctors and they're saying, okay, my client needs this. Okay, I'll send it to our social work team. Oh, well, my client needs a housing and this or that. That is not what I do. As well as now you're saying, when I did get the opportunity to have the clients come in, and I know I'm way over. I know that I am way over. I know I am way over. But I will say, because we'll have more time for that, that safety, that safe space means to me that I feel safe. I have made my client that I service aware that I understand all of the barriers that they're going to and the challenges just to say I need help amidst what every system giving a clog. That safety means I have done due diligence, not just for myself, to make sure that those who are in position that can help hear my story, and I just don't complain. I come with a solution, this is how we can make it better, so that they know, okay, now I finally got to somebody who understands and is going to say, okay, let me walk you through this and see, so I can help you communicate what you need to know better. And for the other end that's providing the service, they can understand what it is that you need. Then I can feel safe. Then I can give that to my client.
Thank you. Should we start with your notes down?
The next questions are really easy. We can.
So what I hear is the need to create a safe space. And in that safety, Vilma, you talked about a person being able to show up authentically without fear of judgment. Stergios, you took us to some of the humility that is involved in creating safety. I have to have an awareness of the power dynamics. I have to work to balance that power that helps to create safety. And I really appreciate it. It is a spectrum that is always evolving. Shawn, you gave us an entry point. How can I see myself in this person and not just have them be the patient and I am the clinician? And Sylvia, you took us really to, there are moments when we as clinicians or providers of color ourselves don't feel a sense of safety. And from that experience, able to draw on that to be able to be with someone in a way that they need us to be with them. So, okay. Next question. what are ways, and I was just kind of summarizing some of the things you've already said, but when you think of ways to create a sense of safety and inclusion for the patients or the communities that you serve, can you share a few of those ways?
I would say that, for me providing or being in a state of actively listening to the client is obviously essential, but also providing empathy. Making people feel like they are being understood. And my way, because my specialty that I focus on is anxiety, depression, and relationship issues, I tend to want to speak with them in terms of what they experience, because, many times people come to me thinking that there's something wrong with them, and I try to make them aware it's more about what happened to you, right? Because that's impacting who you are today, so I think, and with that lens of trying to understand, what they've been through, what they experienced, what influenced their experience, what they value, where did they even get concepts from, idea of love, identity, all of these things shape a person. And for me, being aware of that, going through the process of having, detailed conversations like that, that puts me in a position then to be able to give some validations, because I'm now in a position of knowing truly what they've been through their lens, how it's impacted them. So, being an active listener, providing empathy has been my go-to. And I think there's also the reality of lived experience. My daughter, because I'm a father of two, son and daughter, she would say that I have a huge ego, but I say to her that it's my lived experience why I feel so confident in what I'm doing with people. I've survived a lot, so when I'm working with young people and they tell me stories about, living that life, I'm like, oh, bro, I know, and I can connect with them. Or even if I don't have those opportunities in terms of lived experience that I can share with them, it's the idea that, someone's telling me something, and it's just about me making the effort to, educate myself, so that I can meet them where they are, regardless if I have that shared experience. And again, just providing that safety in terms of the environment, the idea of cursing, when clinicians curse, it's a taboo, because it doesn't speak to the idea of you're a clinician. The word means you have to be professional, proper and stuff. And it's these moments where people are being authentic, and I have to be authentic with them. Like, shit, yeah, that is crazy. I can't believe you survived that, and just by me saying it in that way, it resonates with them, So these are things I think are helpful in creating a safe space.
I have nothing else to say. I guess for me, and I know in the introduction there's that piece, and I think I'll get into that part later. There's a piece that I had left out because I do own cadence counseling, so part of the message there is kind of thriving at your own frequency, and a lot of I have a lot of people that come in, and I've worked in clinic settings and I've worked in different settings, and there's these that, measures. You have to do this much in session 1, this much in session 2. And the beauty of being, I guess the beauty of being able to be in private practice is I have to follow some of it, but I don't have to sit there and be like, let's get this information. I want to know, help me understand what is important to you, what brought you to me, help me understand you. I identify as a queer Latina of color. I have my experiences, and they're going to be very different from yours, even if you do also identify similarly. So help me understand what brought you to me. Oftentimes we're laughing and we're like, I know this is not your typical therapy office because you hear people laughing. But part of the work that I do with people is you have both. You have laughter, you have joy, you have sadness. Let's, be able to incorporate all of that. But from the beginning, not just let's wait till session 3 to figure out, like what makes you tick, what makes you happy. And just kind of really from the beginning, introducing that into everything that we do. Or even acknowledging, like you mentioned, and I mentioned, like, you know, like however you feel like the best to express yourself, do that. I'm not asking you to use any, you know, no jargon, not just talk to me in a way that you would talk to anyone else. And that has gotten so much further as far as helping me understand people and also helping them understand, okay, this is the support I can continue to receive moving forward.
Yeah, for me, I work with a lot of different cultures and languages and costumes, traditions, ethics. And I found that one-to-one therapy is difficult to do, not only because of the language, but because mental health or depression or anxiety or trauma is not, some other countries are not aware of that. They have the somatic experiences and the thoughts and all, but when it comes to seeking mental health, they're not going there. So I created more wellness programs. And what wellness programs are for me is like, I'm certified as a facilitator in trauma-sensitive yoga. And I use that as a way to connect and for others to connect who are in the group. Because doing group wellness programs, it takes the stigma out of being one-to-one, or the family members or friends say, hey, what's wrong with you? But in a group, there is a little more playfulness, there is a little bit more openness, a little bit more vulnerability. So to me, wellness programs are good mental health. It doesn't necessarily have to be one-to-one. And also I'm trained in sensory motor psychotherapy, which it considers the body as a major source of holding trauma, holding depression. So I'm always keen to reading body language or gesture or a movement or a posture or the body keeps a score. There's a book out there, it's called The Body Keeps a Score.
Yes.
I'm not hearing or always listening to what they say, but also I'm attuned to what they don't say, but their body portrays out there. So it's bottom up and also top to bottom processes that I'm also always aware. And I do that a lot in my small private practice, but also bring that to the agency, refugees, helping refugees where I work. So.
I've worked really hard to keep things super simple. And I think anyone that comes into my office space and shares space with me knows I'm just very simple, right? And so in that, I think the first thing I want to say around creating a sense of safety is I've learned that when it comes to people, my clients, I am not the expert. And I actually reject that title or that thought around me being the expert in the space that I share with my clients. So I have learned to step down and to step back because they need that space to be able to learn and see the strengths that they do have. And so I always use language that you are the expert in the room. And it is so important for me to become the student with my clients and allow them to teach me who they are. And then for me to be able to mirror that back. And they do find safety in that, knowing that they're heard, they're seen, they're held, right? They're understood. I honor and respect their human suffering and their human condition. And that allows me to always see the humanity in a person that cannot be not seen. And so I really had to practice really hard to say less, listen more, and to really zero in on that learning piece. I have curated a space, right? Because I see myself in my clients and they can see themselves in me. And comfort is a big part of easing the human suffering. And so one of the smallest but biggest things that I've done recently and I didn't know this was happening until clients shared this with me, but I added multiple pillows to my couch, right? And so I just began to observe how clients were coming in and sitting down. And I think it's been about a couple of months now since I've had these pillows in place. And every client that comes in, there's a part of them that comes activated. I think it's a child part. Because what they begin to do with the pillows, they don't even recognize it until I point it out. A lot of adults, because that's who I predominantly work with, they take the pillows and they begin to build a fort around them, right? And I look at them and I'm like, do you realize you just built a fort around yourself as you're sitting on the couch? And they're like, oh my God, I used to do this when I was a kid, right? And so that sense of safety begins to pour out. And the more comfortable they become, the safer they feel in that space, we are able to do some amazing work. And so with the safety of the pillows, I have also allowed and welcomed, their expressions of their own gifts and talents. And so I have clients who enjoy humor, enjoy food, we eat together, right? It's always gonna be food in my office because it's a connection point. It's a port of entry, right? I can see myself oftentimes in the hunger that they bring when they're coming into my office. So humor, food, touch, and laughter are ways that we connect and are ways that we can find safety within each other. So I really appreciate what they bring to the space. And they also bring their music, poems, raps, guitars. I had someone bring a guitar, like, I want to sing through and express myself and process through my suffering, my challenges through my music. Can I do that? Absolutely. So that is the space that I offer, and safety is a part of that. And it involves all of their gifts and all of their talents. And more of that is visible through our mutual and shared experience. And it didn't start with a pillow, but I think it was definitely enhanced by the pillows that I've incorporated into my office space.
So I am going to try to, as you saw me, we're crossing. But I was going to say, next time I'm going first. But so as not to repeat, the one that I think resonates most with me is the sense of empowerment. And I make sure that my clients, that's most important for me to help them get rid of that sense of helplessness. Like, I can't do anything. And all of the challenges that they are facing, I think I really invest in knowing all of their backstory and meeting them where they are and realizing just because I'm a person of color does not mean that their lived experience is my own. I think they get that everywhere else when they go. For the most part, there are a lot of prejudged assumptions made that this person of color came from living in marginalized areas. They all came from single parent households. They all came from the struggle. That is not the case. So you have to be able to listen and then connect before you correct. As Shawn said, find some way to connect, to understand, okay, well, let me listen to what the problem is, their particular problem, and help them weed out what the system has made. It's easy for us to separate ourselves and go on the racial card. and say we can't connect. But everybody can connect for not being seen, not being heard. No one is really listening to what I'm saying. They're looking at this chart saying, I made an assumption. It says you've got this, okay? And forget about the person. My practice is also faith-based. I don't think I said that. And it's mind, body, spirit, because I know all three of them connect. The education being the mind, how much do they know? Let me listen to see where they're coming from so that I can tailor the message to meet them where they are so that I can then take them. If they have basic needs that need to be met for, they don't care what I have to say. If you are worrying about today, they just called and told me my lights are going to be turned off and this is that, you're going to appear to have more than what your issue is. So I need to make sure that I take care of those basic needs first, see that whole person in that holistic manner, look at those 5 determinants of total health, see them in that before I start making a plan of how do we correct this. What resources do you have access to that I can connect you to so that then we can show you that you have the power? Because I don't need them to become dependent on another system, including me as that system. I need them to know that what you have to correct to get you out of your situation here is already inside you. I just need to get all of my information, ask the right questions so that you know that you have been empowered. You can do this. You can learn to thrive in whatever environment there is. If I can get you the tools to show you that you are capable. And so that makes me know that I've done a good job when they are feeling safe. My practice, to be honest with you, the majority of my practice that I service are not people of color. Most of them followed me from wherever I was working and they came and that became my base. But as I worked with the other churches and going there to say, why aren't you coming out? Then it started to build. But it's pretty diverse now and I service people from every ethnicity. I have some in there that I see. And I think that also adds to, as I'm seeing, it isn't just about Black and white. All of us are having a problem with systems and being seen and saying they need to change to meet what we are. And we need to do something about that. And as a person as a clinician, not a clinician of color, it is my responsibility to say, let's separate the system problems from the individual people problems so that we can get a real good plan to help the people first. That's it. Was that better? A little bit.
I appreciate the theme of lived experience and a lot of what all of you have said. And that important point that regardless of lived experience, regardless of identity, racial, ethnic, or what have you, to be able to connect with people. So it goes back to Shawn's very first statement about entry points and the common humanity among all of us, because it's very easy to get bogged down by the statistics that I showed in the beginning. Not a lot of providers of color. It's going to take years to change that. Let's be real. It's going to take a long time to change those numbers. And so we cannot while it's important that our focus is to diversify the profession, we can't have that be our only goal. People who identify as white or, don't identify as a person of color also need to step into the things we're talking about. How do I have a level of humility to say, I actually don't know what that's like? Do you mind sharing that with me? So, and I will do my own learning as well. How do you sit in that seat of humility again? Because none of us can know anything, none of us can know everything. And so really, how do we listen actively, Show that empathy, invite the whole person, laughter, joy, human, somatic experiences, communal experiences, not just the one-to-one. These are things to be thinking about because particularly, and I'm coming to this last question, when we work in large systems as we do, as URMC, the Department of Psychiatry is, these human aspects can very easily get lost in the care that we provide. So thinking about pillows, we might not be able to have pillows in our clinical spaces, but what can we do? Are there pieces of low-hanging fruit, so to speak, that we can think of to create space and position ourselves? I think, Shawn, again, I'll quote you when saying stepping down, stepping back, to say, I don't know about that. Can you share a little bit with me? And then also go do your homework too. So last question, and then we'll open it up. One thing, y'all.
One thing.
Okay. So in relation to psychological safety and inclusion, what is one important thing for institutions like URMC to consider for both minoritized or underrepresented employees and patients? Employees and patients. Look, Sylvia, like, you ready?
I am ready.
Okay, Sylvia, go.
Training, overhaul of the training of your staff that is meeting with them. Get who you need to retrain the staff. They should address the systemic biases that exist within healthcare and equip employees with the correct tools to recognize and combat these biases in their practice, particularly for our underrepresented employees. It is okay to say, I don't know. Get that base together so that we can talk to each other. And if you are not a clinician of color and you're working with a clinician of color, a client of color, be okay with saying, I don't know, I'm going to consult. Tell me a little bit more how you see it, and just be comfortable because you don't know, and you aren't the expert. As Shawn said, they are the expert in themselves. Write it down. If you just have to write it verbatim or exactly what they say, write it down. Find somebody, what does this exactly mean? Because I'm not sure. And then respond.
So I think one of the things I want to say, so prior to private practice, I worked in several not-for-profit organizations, and I always held position as director of programs and all the things. One of the things that I recognize is that our practices, and we pride ourselves on our best practices, right? Our evidence-based practices, they weren't always reflective of client work. And they were not reflective of just, I think, humanity in general. And so I think the thing I want to say here is, let's stop trying to manufacture human compassion and empathy. I don't think those things can be manufactured, right? And so what it's really going to take, and I can leave this with you for you to chew on at your own convenience around, challenging your own beliefs, your own spirit, your own soul. Because for me, my experience with working with people for so many years, when we've had very heated discussions on how to provide the best care, I've always noticed that at a very deep level, when we have a difference of opinion, right? If we have some biases, this stuff is happening at a very soul, spiritual level. So the thing that I want to leave with you is, if some of this resonates, great. And if some of this drives you to want to do something different, great. But if some of it rubbed up against you, great. Maybe there's some soul searching that needs to be done. And I think that piece is important, to practice your own spiritual and soul work. when you are typing up those treatment plans, or you're creating a diagnosis, or you're tweaking your policies and your procedures, or you're having all the team meetings, if you have not considered the person, if you have not considered their human condition, and if you have not found a point of entry, you have to check within on what prevented me from connecting with this person? Why have I not been able to find that point of entry that is going to connect me, that is going to latch me to that person? This not just for clients, but also for your employees as well. Because as a service provider working in different organizations, I've often felt myself marginalized, not a part of, because I didn't see where I fit. So the next time you approach your client and you're making very crucial and significant decisions for our clients, like the power that we have really requires us to take that step back and acknowledge that person and their humanity. How do I know this person? Because that needs to alter how you make a decision for an individual, a family, and a community.
Yeah. I think they're basic human needs. One of them is like being included. Like the other is allowing people to have a learning safe where they can learn, they receive feedback, they give feedback. Another one is contributing safety, like, empower people to work separately and with teams. And another part is being a challenger to what it is, to how it plays out, and know that it will not be used against you, and everything starts from the leadership and goes down and also goes up. It's like it's an interplay of top to bottom, and the systems work together. I think inclusion and psychological safety are interwoven. If I feel like psychological safety, more likely to feel included, and vice versa. So it's the interplay of that. How do you develop that? But it starts definitely. The leadership has to not only say it, but also mirror it to others, to the different levels, and break those levels through mirroring. Right? You have the power. You have the, you have a choice. You have the invitation from us. So empowerment and embody that. I mean, I can have the invite, but if it doesn't stick with me bodily and make it real for me, it's just a lot of talk.
I think it's like definitely with values, like, understanding what your values are, embracing those that you feel you continue to, that kind of govern your life, but remembering those are the values that govern your own life, not those of the people that we work with. Especially, like when I think about a lot of the patients that come to us, they don't come to us in the best spaces. They come to us in crisis, or, trying to figure things out. And so we don't want to put our values on, and I think of the question, working especially in emergency psychiatry, like, are they future oriented, but based on whose values? If I think about a kiddo, if they're saying, like, I'm not really thinking about college right now, that's fine. That's okay. I want you to be alive to make those decisions. And that's, that's part of it. What do you want to do? What does a week from now look like for you? And really, when we think about like those type of questions, even though they might see like we're going through them quick, like, let's do this, let's do this, let's do this. But really remembering like, okay, if this if that answer doesn't sit well with me, why is that? You know, and then there's not that good enough answer. Like if they don't say this or this or this, then they're not future oriented. Yes, they are. We just have to figure out what future oriented means for them or what is important to them to then go from there. So, you know, and, you know, in terms of like the people, our colleagues, you know, what might be okay. Like, oh, so-and-so looks okay. You know, being able to offer each other that support or our peers that support, not just based on what we see, because, especially with, communities of color, we have, or at least I'm gonna speak for myself, condition like what you see on the outside is not representative of what you see in the inside. So I might be dressed up, all made up, and still feel like the world is shattering. And so recognizing that, you know, being able to put our values to the side and ask those questions, is everything okay? What do you need from me? You know, how can I support you? Or do I just need to be here to listen? And so really taking, again, cherish your values, but do not put them onto others.
I had a tough time trying to figure out what I wanted to say for this question, but I do recognize that I should ask y'all, is this a safe space? Can I give you some real thoughts? I need somebody to say yes.
Yes.
All right, awesome. I made a connection, so I'm gonna try to make it. There, Dr. Terrance was a professor of mine at Cuca College, and in this seminar that we were having, she had brought up a point, and it's resonated with me since. So I'm appreciative. Yes. And I think it makes sense to share it with y'all. The idea of vicarious trauma, but also, you know, you cannot be in this field if you haven't dealt with your own, you know, wounds, demons, whatever word you want to use. All right, because you're just doing a disservice to the people that you're saying you're truly trying to affect and help. So if you're in this room, if you're online and you're hearing me, you have to question what you're in this for. Some people are really in this for money. Hats down, respect. I get it. But if you are trying to live with a deeper purpose in life and you're saying that you are this person who that's a helper, that's a support, or that you just want to be an advocate for people because you've lived through things and you found a purpose in surviving that, and now you just want to be that for others, you have to check yourself. You have to be mindful of what your vulnerabilities are, because when you are surrounded with clients that are from different backgrounds, you don't know what's going to trip you up if there's something that you haven't resolved. Right. You know, so I speak to people about forgiving their family members for what they put you through, you know, like really do the work that you need to like do to be in a restorative state so that you can help others. So that's one thing. Another thing I would say in terms of, you know, what, you know, this organization could be doing, you know, putting their money where their mouth is truly. If you know disparities, there should be funding allocated to, you know, trying to address that. I am, last time I looked, I'm the ninth Black African-American, you know, therapist that's out there that if you look on Psychology Today for Rochester, there's only a handful of us, you know? Why aren't we addressing that? Like my idea, which when I get to a point in terms of status, you know, and get past gatekeeping, I mean, I would love to be able to be in a position where I am working with a high school and a college, and I am trying to facilitate a program that, you know, speak to, you know, African-American males and try to get them into this form of work. Just because I know it's been rewarding. So for me, I just know that if there's work to be done, it's just dealing with disparities. And to my knowledge, you are very rich. And I know people who are higher up when it comes down to why they would do it, it's write-offs. So please write off the effort that you need to like really address the things that need to be addressed. Yeah, I said it was a safe space, so thank you.
Okay. Thank you. We are at time, which I really, again, want to just thank you for taking the time to be with us, sharing your expertise, and we're done. So thanks for joining, everybody.